if you would just introduce yourself and you're recognized to proceed.
My name is John Stephen, Managing Partner from the Stephen Group.
My name is Richard Kellogg, and I'm the Senior Consultant with the Stephen Group.
Thank you, representatives and senators, for the opportunity to meet with you today. I certainly value the significance of your time, and I feel that it's been incredibly generous to allow so much to talk about what is likely some of the most pressing public policy issues in the United States, and especially impacting states and Arkansas. As someone who has run a state health and human service department, I can fully appreciate the challenges that you face, the opportunity, though, that each of you have as committee members to really chart the future of both for the public here and possibly on a national level of the Medicaid program as a whole. Whether it's in our home states, New Hampshire, Washington, or here in Arkansas, every state in the nation is having struggles with the Medicaid program. We look at the National Association of State Budget Office latest data, 22% of the state budgets, on average, consist of Medicaid spending. I think yours is around 21% as of 2014. So that creates more and more difficult decisions to make on your part. And as you have to choose between Medicaid, education, public safety, and a host of other programs that matter greatly to the citizens, that's a challenge. That's where the Stephen Group comes in. We are subject matter experts who have a proven track record of delivering results and making human services in general, not just Medicaid, but human services, run more efficiently for states. While those are buzzwords, and they are said by a lot of folks, we have the proof to back that up. And we've represented to you a lot of our work background, and we'll go over some of that today. So whether it's holding Medicaid spending flat for 4 years, when I was a commissioner and learned how to really be cost effective and ensure access and other quality programs, or some of our consultants who have been in Washington, Virginia, Tennessee, and doing the same thing, or in child welfare, Title 4E, 4D, child support. There are so many different implications to what you do in the Medicaid program that impact a number of cross-agency functions. And you need to be aware of that, especially if you're on a project like this. And what makes us different is that while we have proven experts, we take a blank page approach in every state and every opportunity. We know that every state's Medicaid program is different. We know that there cannot be a one-size-fits-all approach. And we recognize that at every level of our company. While we've had great experiences, outstanding experiences with your neighbors in Texas and Mississippi recently, we know that we cannot bring a cookie-cutter approach to Arkansas. Again, every state's different and every program's different. Instead, we review the data and the programmatic components that flow, and we follow them, and that's where it leads us. Ultimately, for us, it's about meeting the needs of the committee. And that's important to support the decisions. You need to make and give your best tools to choose the best options for Arkansas. And one thing I can assure you that the Stephen Group will never forget their client and who you represent. And it's important when you do an analysis like that you recognize that. The people who will be part of the Arkansas Medicaid team with the Stephen Group, if we were so chosen, would be people who have worked through these situations in the past. Medicaid commissioners, Medicaid experts, individuals that have worked in refining organizations at the highest level. And that's the difference between our team and many others. From our perspective, we view our success as your success, and we are 100% connected. We've left numerous thrilled clients, and we welcome the chance to add Arkansas. So if I may, I'm just going to go through a short presentation, And like the chairman said, we can take questions while we're going through it, and be happy to answer any question at all today. Although I have a flight back at 5 o'clock. If I can make it to the airport, I'd be gracious. My wife would be happy. So basically, I want to go over our objectives that we feel in meeting this objective today. We want to be able to tell you about our experience on an operational level in states, how we've reviewed Medicaid services and state human service programs in the past. We want to introduce our team. We want to review the background of our team with you, our experience and the role of each of the members. We want to review our proposed collaborative approach. Now, our RFP response has a detailed approach, but we're going to hit some of the high levels. We'd like to respond to your questions about our plan, costs, and assumptions in any way. Is that okay? Does everyone feel this? Okay. Now, again, I mentioned senior level experience in our group. When I started the company, after I left the Lucas Group in Boston, and we were doing projects similar to this in states, I wanted to start my own company, but I wanted to have a little different model. I wanted to make sure that I brought in folks that work in government, but also had private sector experience. Work in healthcare, work in human services, at the highest levels. And we don't bring junior consultants in. We have consultants that you meet. Those are the folks that are working the projects. Individuals that serve at high levels that actually are good workers, good consultants, and know a little about data analysis and recommendations, and also implementation, which is very, very important. We have rigorous data-driven analysis. If we were to win this project, Dr. Will Oliver from our team is one of the sharpest, and I've seen him, one of the sharpest data analysts I feel in the country. And he's done analysis for us in all the states that we're going to mention. We also have a practical, tactical approach, and we bring action strategies to our recommendations. And we deliver extraordinary measurable results for our clients. One example is Mississippi. A year ago, the governor wanted to privatize child support. Called us in, and we helped him. And there's 17 out of the 80 counties now are privatizing in child support in Mississippi based on some of our analysis and review. And everything right now is going very well. Both the state employees and the private sector employees are getting along, and things are working. So some of our experience. We have comprehensive Medicaid and human service experience. We've worked on Medicaid reform plans in a number of states. We have worked in Texas, Florida, Maine, Illinois, South Carolina, and Mississippi, all since 2010. I will tell you one thing about our projects too. Texas is a little unique because we like to do an assessment, recommendations, and then leave a lot of the implementation to the folks on the ground that are actually doing the programs. We're not a consulting group that likes to stay in one place and just continue to take from the taxpayer, and we want to get in and get out. We want to do the job and help you. But Texas recently asked us to stay for implementation, so we have a team in Texas helping them with child welfare, Medicaid 4E implementation. So we've done that, and we've done project management. In Maine, we were asked by the governor, actually first the governor, and then the governor's office of policy and management, to look at their budget. Look at Medicaid program. What are we doing wrong, Stephen Group? What can we do to improve our operations? It was a crisis. The governor needed $30 million to fill a budget hole. His office of policy and health management called us. Can you come in here right away, find whatever you can. We need to identify without depriving access and without impacting quality of services. That's one of our good results-oriented platform. Illinois, that was interesting. Illinois was, we did work for Governor Quinn. I served on Governor Quinn's Taxpayer Action Board, Democrat governor, back in 2008, I believe. Delivered a lot of recommendations on Medicaid reform that the governor used in his budget that year. And when I started my company, I was asked by the Policy Institute and the Senate in Illinois to come and testify before them on the Medicaid cost drivers. We did some work for the Illinois Policy Institute as well. And I recently served or helped the governor's, the current governor, Bruce Rauner's transition team in finding the best executives to run his agencies. South Carolina, both Richard Kellogg, myself, and a few others on the team who will be in Arkansas if we were chosen, helped Governor Haley when she first became elected and saw our long-term care issue that she needed addressed. And we went in and evaluated, assessed their entire long-term care program. Subsequent to our report and recommendation, South Carolina has adopted a dual eligible strategy going forward, comprehensive strategy based on some of our recommendations. Mississippi, we've done a couple projects in Mississippi recently dealing with Medicaid. One was on the eligibility side, how there was a 90-10 funding opportunity at CMS. Mississippi called us in to see how we could integrate the human service system with the Medicaid system so that both those systems can communicate together. And all the consultants would come in on the IT side and say, it's going to cost you $50 million. You're going to have to pay all kinds of money, all kinds of new systems, and we come in, because they trust us, tell us really what is it going to cost. So we came up with about a $15 million solution for them, which the Medicaid and Human Service Department, still with the governor today, are looking at. Florida, we were asked to go in. Florida had a problem with fraud in their Medicaid Human Service TANF. And Florida asked us, they call it the Office of Benefit Recovery. They had an RFP. We responded and we were selected to go in and look at the system and assess. And then also give us recommendations how we can fix any potential fraud that you see that we're not capturing today. And what happened in Florida was, basically we found that there was a slew of individuals getting food stamps that were at the same time getting unemployment insurance. And Dr. Oliver and my team was able to begin to put those systems together. So when you go in for food stamps in Florida in the future, you are not, if you're getting unemployment, your food stamp allotment goes down. So you're not going back and chasing after these people later on, because that's actually fraudulent activity. When you don't tell the state, you're also getting unemployment. And I don't know what the systems are here, whether they even communicate, but those are the areas that we looked at in Florida, and they used our recommendations there going forward.
Can you tell us what the net decrease in the claims, what did that translate into in dollars?
Well, it's a good question, Senator. We gave the recommendation that we thought there was about $40 million in backlog that they could look at. And we gave them an idea with a bunch of recommendations on the future, how to connect those systems. We weren't asked to connect, because we're not an IT company. They liked our recommendations, like Texas, so much that they said, we're going to put out another RFP, and if you're interested, we're going to be asking someone to come in and do a pilot program based on your recommendations, just to see if we can capture some of that fraud. So we bid on that second program, and we won the bid. And we went in Tampa, and we were there for 4 months. I hired a team that actually worked alongside the state, so we can train them and have a continuous quality improvement program to hand off to them. And our contract was $300 and some odd thousand. And we were really deliver an ROI, and we were able to capture $800,000 in fraud in that 3.5 month period. So we left showing them how to do it, and at that point, I have not checked to see exactly what it is today, but I'm sure it's several million. And then I wanted to make sure we had some testimonials. I know that individuals have been contacted, because folks have contacted me saying that Arkansas has one of the governors in New Hampshire, Benson, that I worked for, called me and, what's going on? Why is Arkansas calling me? I made a big tactical error. I didn't call him ahead of time. I put his name down, but I'm sure it was a good recommendation. Bottom line is, there's a lot of testimonials that we have that I just want you to see what some of the key folks that we work for have said about us in the past. In Mississippi, Maine, I added a couple in Florida, and the waiver in Rhode Island. Before I started the Stephen Group, I was asked to go into Rhode Island and assist the governor because he was having a hard time figuring out exactly how how the waiver can be structured, and I negotiated the 1115 with the secretary and gave them a lot of ideas to really make that happen. So what are the key benefits of having this feeding group here helping you? I've mentioned a lot already, but I think it's important to really underscore this rigorous financial data / program audit. I will tell you, whoever you select, it doesn't matter who it is. They have to be able to know where to look immediately. And I would do, the first thing I would want to do is to conduct a pretty comprehensive audit of the prior spending and the historical patterns. Where are you going? What is your caseload increase over the past few years? What are some of the cost drivers? What is what we call the age, blind, and disabled spending? Usually that 80-20 rule. Is it that way? What is some of the institutional versus the non-institutional spending? What does it look like? And then the expansion population added to that as well, the private option. So before you get really on the ground with my team starting to do the things that we need to do, we need the data, and we need to talk to the Medicaid folks. But the data is going to drive a lot of our thinking and feelings, and that's why in our RFP, and I want this committee to know it's so important and it's critical to make sure we get access to data, and we'll talk about that. Policy level strategy that links Arkansas Medicaid improvement strategies to alternative coverages. You know, knowing out there what's working in other states. One of the reasons why Texas hired us with 35 or so vendors that most of them were from Texas, and we were coming in out of state, and they were, wow, that's an interesting group, let's find out more, was because we can bring a lot of that best practice analysis to them, things we've been involved in, what we've seen, and what could work into their state. Provider contracting strategies. We have individuals that know contracts. One person on my team, Martha Tuttle, was 30-year Accenture exec, and is doing a lot of work when I need to look at a state and find out what their contracts, whether they're doing the right thing in terms of vendor management, contracting. Are they looking at every area for efficiency and determining whether this is the best contract for the taxpayers? And that's an important issue in Medicaid. Eligibility integrity, I cannot underscore that. We have some folks on our team, and I have experience working with Mississippi and other states in integrity on the eligibility front. You need to scrub your data. You need to scrub your eligibility data and identify how many out-of-state residents are getting benefits in your state. And this happens. You need to identify how many have certain income thresholds in the asset verification area that if you had electronic access to some of your banking information, they wouldn't be on the Medicaid system. I mean, this is not about taking those off that should be on the program. This is about making the program truly available for those that are truly eligible. And that's what the intent of the program is. And we have individuals on our team that know data, know the eligibility system, and immediately will start looking at what system you have today. No preconceived notions, so we don't know what the system is. And how are they identifying eligibility today? And I just think that's so critically important. Linking healthcare coverage to personal choices and transparency. Making sure that individuals truly get the information they need to make the right choices. What are they getting today? And what disturbed us, our team greatly, was we were in Pennsylvania and we were looking at managed care. And we found that in a certain area of the state, the managed care costs were such that one hospital in Philadelphia, right across the street, one was Temple, another hospital across the street, colonoscopy was $5,000 here, it was $2,000 here. And Medicaid didn't care, and they would just pay both of them. And there was so much waste there that we've got to figure out a way to let the consumer know what the true cost is. And let them be a part of that decision making, because the consumers will make the right choice. But the problem is the Medicaid program doesn't give you all those choices. So we're familiar with analytics. We're familiar with looking at DRGs, CPT codes. And I think it's important that you have that type of, whoever you choose, that you have that type of innovation. At least so you, the committee, can make the right decision. Time phase cost reduction targets, each change is going to have an implementation time period. It's going to be historical, future implications or things that we've got to dig into to outline for you in terms of implementation, making the strategic decisions. And you're not going to agree maybe with everything, but you need to know what the impact will be. And we can provide that for you. I think one of the most important things is this last line. We focus on what the high-risk, high-cost populations are and identify alternative ways of better care, higher quality, more consumer direction. And you need to know if that's not happening here. You need to know. And if it can be elevated to a much better level for the consumers and the families and individuals, you also need to know. So our project team, for this particular project, when we were putting the RFP together, we sat down with our team, and this is a very competent, highly skilled team. I want to introduce some of their background. They're not all here, but if we were chosen, they would be coming in and out at different times. They would only be here when they need to, but they would look at that. Richard Kellogg would be here almost every week. I'd be here almost every week. We have Dr. Oliver that's going to be here almost routinely during the weeks. You have Richard, who I'm going to ask Richard now if I can deviate and I think it might be beneficial. It's in the RFP, but I want to real briefly go over the background. Would that help? Because I don't know if everyone's looked at all the background, but I was a former commissioner of health and human services in the state of New Hampshire. I had an umbrella agency, so I had public health, behavioral health, development disability, Medicaid, child welfare, juvenile justice, 3,000 employees, and we're the largest department in the state. I ran it for 4 years. Prior to that, I was deputy commissioner of the Department of Safety, involved with state homeland security. That's when I did know that your governor was in homeland security at the time. And before that, I was assistant attorney general. I have a background as a prosecutor. I was a homicide prosecutor, and I'm involved in child sex crimes. So that's kind of my background. And Richard Kellogg, I'll give you a chance to give your background.
Thanks, John. I spent 2 years as a therapist. I spent from 1974 to 94 as a CEO of community programs involving mental health, developmental disabilities, long-term care, substance abuse, including inpatient, outpatient, and hospital units. In 98, I went to work for the Commonwealth of Virginia's deputy commissioner, was appointed commissioner by then Governor Allen, and followed up by then Governor Gilmore. And during Governor Gilmore's term, we resolved 4 standing Department of Justice lawsuits, ADA lawsuits. You got some of them here. Unfortunately, we went back to Virginia. I got hired after that administration ended by the Sunquist administration in Tennessee, when TennCare was actually blowing up before Governor Bredesen actually took a fiscally prudent approach and pruned the program down. And in that program, I developed a cost-effective solution to their several lawsuits in the developmental disabilities area, and their $82,000 a year annual waiver cost, when the state national average at that time was around $33,000. Then I went to work with John in New Hampshire, where we reformed long-term care under his leadership. And then I moved out to Washington, where I spent the last 5 years working in the Gregoire administration, which, as you know, was extraordinarily expansive under the Affordable Care Act. So I saw decisions made that were both fiscally sound and fiscally risky. In my last year there, I was involved as the Director of Integrated Health Services for the then $11 billion Secretary of Health and Human Services, which included the Medicaid program. Left then, I've been working with John and do some independent work, and do a little bit of work with UW every now and then. I've been involved in Medicaid policy from the provider side through today as a provider, CEO, and advocate for more expenditures. Working for very conservative governors in a couple of states, a very liberal governor on medical spending for the last 5 years, and have concluded what John had said earlier, that each state is unique and it needs their own unique state solution.
And if we look at just the other members real briefly, Dr. Oliver. Dr. Oliver is an MIT grad. PhD, he's a professor as well. at Brandeis University, and that's why during the summers, usually he's working for me full-time. While he's teaching, he usually commits to about 20 hours a week. His 20 are like 60 for anyone else, so I have value with Dr. Oliver. He also worked with Governor Romney at Bain and was involved in a lot of private sector acquisition in healthcare and knows the healthcare industry extremely well. Rory Rickert is a pharmacist, expert, national expert, who worked with me in the Rhode Island waiver as well, came up with some great pharmacy-based solutions, and also, when I was commissioner, helped me save a tremendous amount of money in consolidating some of my pharmaceutical purchases with other states. By the way, we're the first state to have a purchasing pact with 5 other states to really, collaborate, but also aggregate our spending and save money. He'll be a big part of this team, because I think that looking at a high level, we haven't dug into a lot of the data, but just looking at the data from the outside, I'm really interested in seeing what's going on with the pharmacy programs here. And he'll be very helpful. Bob Chin is a national expert on claims, so looking at the DRGs and CRT codes. Bob Chin led the effort in the state of Pennsylvania that he has a data mining tool that's able to extract episodic care. So he can tell you the average cost for each episode at every hospital in this state if he gets access to that data. And I want to make sure we get that data. Martha Tuttle, I told you about earlier, was formerly with Accenture. Martha's been leading some of my organizational efforts in Texas and doing a great job.
Okay, we've got one.
Question?
You have a question? Change mine, sorry, go ahead.
Okay. Martha is a great acquisition to our team, and she's been working with me for the last couple of years. Contracts and organization. She will look at the state organization, identify, at a high level, but then really start to dig down and help you identify, is this the best way that this is structured? Lindsay Littlefield is a data analyst, worked at the Legislative Budget Office in Texas, and Sharp, and she predominantly in Texas worked on the developmental disability state institutional data and was able to analyze a lot of issues that led to statutory changes. She'll be working with Dr. Oliver. Jason and Michael are data eligibility experts. They're working in Maine right now, and one of their projects is on EBT cards, and they're able to allow the state real time, that the fraud investigators real time can now see where all the EBT purchases are being made within the state. So if someone's at a casino using the EBT card, they're going to know instantly, based on some of the work Jason's done. Very excited to have him join us, and Jason will be someone that really will know how to look at that eligibility system. And this is, I think, the last slide, or next to the last slide. We see key roles. Like I said earlier, the client is this task force. We would like to just throw out a recommendation, if we're chosen, to have a project steering committee to work with. We also feel that we need to have access to the agency. We are going to need to be able to meet with the people at the agency, to identify data quickly, and to really be able to have them share critical information with us. So that collaboration is going to be really important. But it's not the agency that's the client, it's this task force. But we want to work with data. Again, I can't underscore right away. We would probably, our first thing to this committee, if we were chosen, would have a data request that we would put together, a number of pages, and let's get started, and here's what we need. While we're doing that, Richard, myself, and others will immediately start digging into the programmatic stuff that we need to look at. Swiftness, accuracy of the data, access to people, really critically important. So I think we've already gone over most of this. Best practices nationally. I know a lot of firms that we work with, consulting firms that are involved in a lot of our bids, and I don't see the national type experience. Best practices nationally is so critical to a project like this. Timing, this is in the RFP. We have a Gantt chart, and we can probably address that Senator and Representative chairs at most of the questions, if we have questions about the timing of the work. But we have well thought out what we think this project's going to need in terms of, timing, different milestones. And we use a project management approach in all the projects we do, so that we are very strict on timelines within our firm and meeting deliverables. And we want to have monthly updates. We want to make sure we even get, in every state, we usually have a preliminary draft report that we give before that report is publicized or released, so that individuals can have the ability to look at it from the committee and respond and tell us where they think we might be wrong or where should we look further. And we would do the same in this project. And these are some of the assumptions: timely data, immediate access, collaborative involvement, support, coordinated appointments. We would need some support. Because again, we're coming at this independent, fresh faces, not knowing a lot about who the right individuals are to meet with and talk to and get the historical. But we can quickly absorb, and we do a lot of focus groups, and we do some really very well thought out, well prepared group discussions. So why should the task force select the Stevens Group? Again, when I said important project, this is very important to you. No question, maybe the most important project in this state. And we are serious about that. Commissioner Kyle Janik, the Health and Human Services Commissioner in Texas, recently testified in front of the legislature after we delivered our report. And he said that this was the most important project in the state of Texas for him. And we delivered, results that he was very happy with. We are a senior team, deep experience. We have a proven method of process improvement. We have what's called brown paper process. If we develop, the work groups, we'll probably want to see, what it looks like in terms of time and how workflow happens in the organization. Data driven. And that's basically it, Mr. Chairman. Be happy to answer any questions.
All right, we have four standard questions, and so I'm going to recognize Representative Murdoch to ask the first of our four standard questions. Representative Murdoch, you're recognized.
Thank you, Chairman Collins, and thank you to the Stevens Group for taking time to be a part of this process. We really appreciate you being here. The question is, describe what makes your firm unique in this industry, in the industry.
Thank you, Representative, for that question. I think that the way to answer that is we've gotten our hands dirty. We've actually done it. We have individuals that have had innovative